Hi everyone, welcome to iMumz Ask Me Anything session. Today we have Dr. Surekha Tayade, and she is one of the most senior professors and unit head of Jawaharlal Nehru Medical College in Wardha, Maharashtra. She has years of experience in the field, and she will be speaking all about C-section today. And you can take this opportunity to clear all your doubts you have regarding C-section, and ma'am will be happy to answer your questions. Over to you, ma'am.
Thank you so much. Good evening everyone. I'm Dr. सुरेखा तायडे और सबसे पहले नववर्ष की आपको बहुत बहुत बधाइयाँ। 2021 आपके लिए बहुत बहुत शुभ चीजें लेकर आए और जैसे कि हम लोग सब जानते हैं कि अभी वैक्सीन भी आ गई है तो कोविड का डर भी धीरे धीरे हमारा कम हो जाएगा। और आज और इसी के साथ में डॉक्टर जयदीप मल्होत्रा जो कि iMumz की डायरेक्टर है, उनका भी धन्यवाद करना चाहूंगी कि उन्होंने मुझे यहाँ पर बुलाया और आपके साथ बातचीत करने के लिए, रूबरू होने के लिए मुझे मौका दिया। तो आज हम जानने वाले हैं सिजेरियन सेक्शन के बारे में। व्हाट इज दिस सिजेरियन सेक्शन, व्हाट काइंड ऑफ ऑपरेशन इट इज, उसकी कुछ क्या इंडिकेशन है, किस लिए हम ये सिजेरियन सेक्शन करते हैं, उसके क्या क्या एडवांटेजेस हो सकते हैं, फायदे क्या हो सकते हैं, कुछ डिसएडवांटेजेस भी है और कुछ कॉम्प्लिकेशंस भी है। इसके बारे में आज हम जानेंगे। तो सबसे पहले हम जानना चाहेंगे कि व्हाट इज द सिजेरियन सेक्शन, ये क्या है। और तो सिजेरियन सेक्शन के बारे में तो हमारी महिलाएं काफी अभी जानने लग गई है कि दो प्रकार की डिलीवरी होती है। एक तो है नॉर्मल डिलीवरी जिसको हम कहते हैं, दूसरा है कि ऑपरेशन से जो बच्चा पैदा होता है इसको हम सिजेरियन सेक्शन कहते हैं। तो जब हम पेट के ऊपर या एब्डोमेन के ऊपर इंसिजन देते हैं या चीरा लगाते हैं और गर्भ पिशवी जो है उसको भी चीरा लगाकर बच्चे को बाहर निकालते हैं, उसके हम सिजेरियन सेक्शन कहते हैं। अभी देखिए जैसे जैसे टेक्नोलॉजी बढ़ते जा रही है, हम वैसे वैसे हम बहुत छोटे गर्भ भी जो होता है उसको भी वो बच्चे को भी हम बचा सकते हैं। जैसे कि 28 हफ्ते का गर्भ भी होता है, उसको भी हम बचा सकते हैं। तो ऐसे में जो भी बच्चा हम लाइव पैदा कर ले और अच्छे इंस्टीट्यूट में तो 28 हफ्ते का भी बच्चा जो है, 1 किलो का भी बच्चा या उससे कम का भी बच्चा जी लेता है। तो ऐसे बच्चे को अगर हम गर्भ टिश्यू के ऊपर एक इंसिजन लेके उसको बाहर निकालते हैं तो उसको हम सिजेरियन सेक्शन कहते हैं। यूजुअली तो बच्चा जो है 40 हफ्ते का पूरा होता है और 2.5 से 3 किलो यूजुअली होता है, उससे भी ज्यादा बच्चे का वजन हो सकता है। तो अभी ये सिजेरियन सेक्शन हम देखेंगे कि इसका जो सिजेरियन सेक्शन का इंसिडेंस पहले काफी कम हुआ करता था, अभी जो है इसमें बढ़ोतरी आ गई है। अभी बढ़ोतरी क्यों आई है, क्योंकि ज्यादातर सिजेरियन सेक्शन अगर अच्छे टेक्निकल हैंड, ट्रेन हैंड से आप करवाएंगे तो सिजेरियन सेक्शन को काफी सेफ समझा जाता था। पहले जब इसके सिजेरियन सेक्शन सबसे पहले इजाद हुआ था काफी 100 साल पहले, तब कठिनाई थी, एनेस्थीसिया का प्रॉब्लम होता था, एंटीबायोटिक्स की वजह से। एंटीबायोटिक्स तब इतने अच्छे से नहीं आए थे, सूचर मटेरियल जो सिलते हैं हम गर्भपिशवी, वो मटेरियल इतने अच्छे से नहीं आया था। तो इसलिए थोड़ा सिजेरियन सेक्शन में ऐसा लगता था कि उसमें कोई रिस्क है। तो जैसे जैसे टेक्नोलॉजी अभी आगे बढ़ रही है, एनेस्थीसिया काफी सेफ हो गया है, अच्छे एंटीबायोटिक्स आए हैं, हम लोगों का ऑपरेशन थिएटर भी बहुत साफ सफाई वाला हो गया है, ट्रेनिंग भी काफी अच्छी हो गई है। That's what has happened कि cesarean section has become quite safe and certain procedures जो काफी complicated और difficult procedures जाने जाते थे, जैसे कि forceps डिलीवरी है या फिर ब्रीच जो पाँव से बच्चा रहता है, वो जो पहले नॉर्मल डिलीवरी करा लेते थे, तो अभी ये जो है नॉर्मल डिलीवरी, ये कॉम्प्लिकेटेड नॉर्मल डिलीवरीज थोड़े कम हो गए हैं। हमारी महिलाएं भी जो है अभी थोड़ा एज उनकी थोड़ी सी प्रेगनेंसी की एज थोड़ी बढ़ गई है और कुछ आईवीएफ से भी बच्चे पैदा हो रहे हैं। तो ये जो थोड़े से ट्रेंड हो गया है कि थोड़ी महिलाएं ज्यादा उम्र की होगी और कॉम्प्लिकेटेड जो हम पहले डिलीवरीज करते थे वो भी कम हो गई है। हमें सेफ्टी चाहिए है, हमारे को बच्चा जो है, बच्चा और जच्चा काफी सेफ चाहिए। पेन टॉलरेंस थोड़ा महिलाओं का कम हो गया है। इन्हीं सब वजह से क्या हुआ है कि सिजेरियन सेक्शन का ट्रेंड जो है थोड़ा बढ़ गया है। और हमारी महिलाएं जो पहले जो 25% से कम हमारा सिजेरियन सेक्शन का रेट था, अभी वो थोड़ा सा बढ़ गया है। तो अब हम
मैम,
देखना
सॉरी
चाहेंगे कि
टू
सिजेरियन सेक्शन की
इंटरप्ट।
इंडिकेशंस क्या है, मतलब हम किस लिए ज्यादातर सिजेरियन सेक्शन करते हैं। दो प्रकार के सिजेरियन सेक्शन एक होते हैं।
मैम,
एक तो हम लोग इमरजेंसी में करते हैं किसी इमरजेंसी की वजह से, जैसे कि बच्चे की दिल की धड़कन कम होना, जिसको हम कहते हैं कि फिटल डिस्ट्रेस। तो ये जो
Ma'am,
है,
a small request from the viewers. We have a lot of viewers in English, जिनको हिंदी नहीं आती है.
okay,
So if
so
you
you
could speak
want
a
that I
little,
should talk in
yes,
English only. No
little
problem.
bit of
So I
Hindi
will
and
go and
English
talk in
would be
English only.
no
So not a
problem.
problem. So what I was talking about is that the maternal indications. What are the indications for cesarean section? So maternal indications could be like contracted pelvis. Pelvis जो है, contracted pelvis or a cephalopelvic disproportion. This is one of the maternal indication. That certain complications of pregnancy, like pregnancy-induced hypertension or eclampsia, there could be a previous cesarean section. So there could be a big baby because of diabetes mellitus, and also there could be fetal indications. One of the fetal indications which is quite common is a fetal distress. What do you mean by fetal distress is because of the labor, the progression of labor, the fetal heart starts dropping down, which we call as bradycardia, or the fetus is not able to bear the stress of labor. And that's why the fetal conditions become abnormal, which we call as fetal distress. And because of that, the cesarean section is indicated. So we have two types of cesarean section, as I have already said. One of the cesarean section is called as an emergency cesarean section. So because of some problems in the baby or the progress of the labor is not proper, initially the progress of the labor may be good, but because of the arrest in the dilatation of the cervix जो है open up नहीं होता है, so because of that maybe or the full dilatation may occur and there may be arrest in the second stage of labor, and because of that the decision for cesarean section is taken. Another indication is an elective cesarean section. मतलब we decide, we take a prior decision that we have to do the cesarean section, and that cesarean section is actually planned. Okay, so you can plan that cesarean section depending on what is the indication. Like if it is a previous cesarean section, previous baby also was born by cesarean section, and now also you find that the pelvis, the bony pelvis may be not adequate for the baby to deliver. At that time, you may have a planned cesarean section. So these are certain indications of cesarean section. And usually what happens, we would like to do a cesarean section at term gestation. What do we mean by term is after 37 weeks of gestation. So as I have already told you, the gestation age is 40 weeks. The completed gestational age of 9 months is 40 weeks. If we should usually plan a cesarean section after 37 completed weeks of gestation. So pregnancy should have completed minimum 37 weeks, that we call as term gestation. Sometimes what happens that because of certain pregnancy complications like pregnancy-induced hypertension, you may take a decision to do a cesarean section prior to the 37 weeks. Like the BP is rising too much and there is risks to the baby, so or the risk to the mother. In that condition, the doctor may take a decision to do a cesarean section prior to the 37 weeks of gestation. In that case, the doctor will give certain injection, which we call as betamethasone or dexamethasone injection is given to the patient so that the fetal lung maturity, बच्चे का लंग जो है तैयार हो जाता है, जिसको हम कहते हैं fetal lung maturity, that is attained, and after that cesarean section is taken. So your doctor will actually discuss with you what is good for you, what is safe for you, what is safe for your baby, and accordingly the decision will be taken. Most of the time, you will be told about what is the indication and how you are going to go about doing the cesarean section. Okay, now we will go and discuss how the procedure of the cesarean section occurs. Usually, we would like that the patient who is undergoing the cesarean section should be nil by mouth. Nil by mouth का मतलब है कि at least 6 hours before the start of cesarean section, she must not have had food or even anything to drink. So because because of the anesthesia, there is chances that the patient will vomit during the procedure. So we want to avoid the complication of such complications of anesthesia. So we want that there should be a fasting status of at least 6 to 8 hours prior to the cesarean section, and that will create a safe atmosphere for anesthesia. Now, if we take a cesarean section in an emergency, sometimes the patient may not be nil by mouth. However, the anesthetist will administer certain injections, which is called as ranitidine or perinorm, which we give to avoid the vomiting, and that may make the cesarean section safer. So one is the fasting status. Second is the consent from the patient before you go and do a cesarean section. And the mother's blood group also should be noted, because if there is excessive bleeding and if you want to give a blood transfusion to the patient, then your blood group also should be known to your doctor. If there is an Rh negative mother and a negative blood group hai, so the blood also should be stored and available in the blood bank, and accordingly the patient will be then taken to the operation theatre for cesarean section. What anesthesia which we prefer? We prefer usually a spinal anesthesia. Okay, spinal anesthesia is actually when we administer the anesthetic drug through the spinal route. Spinal matlab पीठ में सुई दी जाती है, and then through that route the anesthetic drug is given. So we do not actually use general anesthesia. We use, this is called as a regional anesthesia, which is safe for both the mother and the baby. Only in certain conditions like eclampsia, when there is pregnancy as well as convulsions, we use a general anesthesia, जिसमें पूरी body को anesthetize किया जाता है. So that is usually not preferred. We prefer that you give a spinal anesthesia. And after a proper aseptic precaution, the cleaning and draping of the patient is done. Abdomen is actually cleaned very well, and after that proper drapes are used and the incision is given on the abdomen. What type of incision do we give? We give a transverse incision. Horizontal incision is given. We do not prefer a vertical incision. Incision is given just above the symphysis pubis, so that it is cosmetic also, and as well as the access to the uterus is also very nicely available in that area. So transverse incision is given, and then after that we enter the abdomen, and we will look at the uterus, and again we give the incision on the lower uterine segment. So that is considered as safe for your baby and you, and through that lower uterine segment we'll open the uterus and remove the baby. Okay, and after removal of the baby and the placenta, then what we are going to do is suture take some sutures, or take sutures on the lower uterine segment. Whatever uterus we have opened up, we would like to stitch it back, and then after achieving proper hemostasis. Matlab kya? So we will see to it that the blood loss or whatever the incision we have opened up, we nicely close it, and there is no bleeding at all, and then we close the abdomen also, and properly we will suture the skin also. Usually the doctor would like to take subcutaneous sutures, so that a nice suture line is given to the patient. It is cosmetic as well as healing is good. Sometimes if the approximation is not good, or there was a previous cesarean section because of which the approximation is not good, we may take the mattress suture also. Normally, it may be taken by non-absorbable suture material, and after 7 to 8 days of the cesarean section, then the sutures are removed. Now, usually it happens that the patient is uh, kept, again, not asked to take any food or water by mouth till 8 to 10 hours. If it's a complication cesarean section, maybe 24 hours also, the patient will not be allowed to take any food or any drink or any water. And after that, after the assessing the condition of the patient, she will be allowed to have some food or any drinks. And usually we will like to give some IV antibiotics to the patient. And after that, maybe 24 hours. And after that, once she starts on orally, then you can either give oral antibiotics to the patient. And she will also be given some painkiller drugs so that the pain which is associated with the incision will be less in these patients. Now, this is about the anesthesia and what kind of suture material you're going to use. Most of the time, cesarean section is considered as safe. However, sometimes there may be certain complication. If she is a previous cesarean section, पहली बार भी उसका cesarean section ही हुआ है, so this time the possibility is that the complication, the risk of complications are more. Okay, because the placenta is sometimes adherent to the previous cesarean section, and thus the complication may be more. However, a trained obstetrician is able to deal with these complications. Sometimes what happens if it's a very advanced labor and is a second stage cesarean section, then there may be difficulty in removing the baby, and there is possibility there is the extension of the scar, and there may be little excessive bleeding, maybe there some injury also to the is possible to the intestine or the bladder during cesarean section if lot of adhesions are there. In previous cesarean section, if the uterus is completely adherent, then there is a possibility. However, carefully done cesarean section and experienced obstetrician is able to deal with these complications. So there are certain possibilities of infection or post-operative fever, and stitch, some infection in the stitch, or some delay in return of the bowel movement, and which we call as paralytic ileus. So these are certain complications which we should know of, and we should be ready, and thus we should, the women who are watching this show should also know that, vaginal delivery, if you consider vaginal delivery versus cesarean section, then vaginal delivery, जो उसको हम normal delivery कहते हैं, the normal delivery is of course much safer than the cesarean section. However, if there are certain indications like fetal distress, if the pelvis is not adequate for the baby, if the patient is having comorbidity, lot of complicated complications, the blood pressure is very high, the baby weight is very large. So in that case, a trained doctor will be able to, very nicely and safely deliver the mother with the help of cesarean section. So we should always be ready to discuss with our doctor what is the need for cesarean section, why we are doing it, what are the possible complications, and what are the benefits if you are doing the cesarean section, and what may be the disadvantages. So if you nicely discuss with your doctor and you're ready, then whatever apprehension you may have, you may be afraid of the procedure, that may be relieved if a proper counseling session with your doctor is there to help you out to take the decision whether you would like to go for a cesarean section and or whether you would prefer a vaginal delivery. So the decision is actually resting with the couple, and if a proper knowledge and awareness is there, then the fear factor and the apprehension associated with the procedure will always be less, and good rapport between the doctor and the pregnant lady and the couple will make all these procedures more safer, and the patient will be much happier. Satisfaction of the patient will be much better. Thank you very much for listening. I'm there to take your questions. I'm not able to
Oh,
hear
yes.
you.
Yes. Thank you so much, ma'am. We all got to learn so much in this session with you today.
I'm not able to hear
I'll.
you again. Can you increase your voice?
Uh, I. Okay. Can you hear me now?
Yes, better. Just take it a little bit nearer.
Okay, sure. I'll speak to you this way.
Yeah.
So we have a lot of questions. I'll move on to them quickly. Ruchi has a question. She has a low-lying placenta. I think many of them have this question: breech position. Is it possible to have normal delivery, or should they opt for C-section?
Okay, so when we talk of a low-lying placenta, we also say that the technical term for that is placenta previa. Now, when we talk of placenta previa, there are various grades or types of placenta previa. And when we say type 1, 2, and major degree of placenta previa, that is 3 and 4. So in 3 and 4, the vaginal delivery or normal delivery is not possible because the placenta is covering the internal os, so it is not possible. Then in type 2 posterior, jahan pe placenta is posterior, which we call as type 2 posterior, also we should not go for a vaginal delivery. Only in case of type 1 placenta previa, only in case of type 1 placenta previa, we can consider a vaginal delivery. There too, the doctor will assess, and there too, the doctor will assess and will find out whether the placenta is really coming into the way, and then only in a good institutional setup where the blood is available and everything is available, then only the doctor may take a decision for vaginal delivery. Otherwise, it is much safer to go for a cesarean section. Thank you.
Thank you, ma'am. Shruti has a C-section planned tomorrow. She wants to know if she will be able to breastfeed her baby within 1 hour.
Okay, so now breastfeeding the baby within 1 hour in a cesarean section is advisable. However, that decision will be taken if she is able to bear the pain, and if she can if it's a general anesthesia, then she cannot breastfeed. If it's a cesarean section, again depend on the patient how much she is able to bear. Usually we say that we can take 3 to 4 hours for the patient to settle down, and then we advise a mother with a cesarean section to go for breastfeeding. For vaginal delivery, we say that within an hour we can go for breastfeeding. Of course, it depends on the patient also, how much she is motivated to breastfeed her baby, and depending on that, she can try to feed the baby as soon as possible or as soon as she is comfortable. Thank you.
Thank you, ma'am. Deepthi has a question. I think there is one more question related to this. The baby's umbilical cord is around the neck. So is there any chances of normal delivery, or should she plan a C-section? I think her AFI is also slightly low.
Okay, now there are two things. One is when she's saying the baby has a cord around the neck. Now there are three types of cord. One is a tightly wound cord, and another is a loose cord. You know, if there is a cord around neck, is it a single loop of cord or is it two loop or three loop of cord? That also has to be decided. Okay, and then if the AFI is less, then there are two conditions existing in one condition. So now you have to balance the risk to the baby against the advantages of having a vaginal delivery. Therein, what the doctor will do is take out what we call as a CTG. Just like we do a ECG for the mother, there is a ECG for the baby also, which is a recording on a paper which will tell us whether the baby's heart is going on well, it has good acceleration, there is no distress. In that condition, if the head of the baby is nicely fixed, it is a spontaneous labor, the labor is progressing well, and a good monitoring is there, then we can go for vaginal delivery, but you have to monitor the labor very well. In case the baby's heart dips, there is a bradycardia or there is any risk to the baby, at that time we may consider an emergency cesarean section for these patients also. So the doctor will have to assess the condition of the patient, the condition of the baby, the progress of the labor, and then only decide whether she could go for a cesarean or vaginal delivery or she could have a planned cesarean section. In case she opts for a vaginal delivery, then good monitoring is important, so that any time during the progress of labor, if there is a distress to the baby, then she can be immediately taken for cesarean section. So safety to the baby and the mother is both important. Thank you. Not able to hear, dear. I'm not able to hear you, but I am able to read. So is this the same question? My mother is not keen to do a cesarean section, but my husband is recommending me to do it. Stitches come in both. So is still cesarean section recommended? So there is some discussion about the mother-in-law being favoring of a vaginal delivery, but the husband is in favor of a cesarean section. So that is the question. Now, with both the things, what we have to remember is what is the indication for cesarean section. Now, if the indication is such that both the safety of the mother and baby is while doing a cesarean section, and the doctor is also advising you to go for a cesarean section, then of course you need to follow the doctor's advice. What are the complications in the pregnancy? All that has to be taken into consideration. What is the profile of the patient? The profile of the patient also has to be taken into consideration, and accordingly the decision has to be made. And the mother-in-law may be having some prior bias in our mind that cesarean section is not good, but we can take her, we can counsel her, and we can decide according to what are the complications. If if no complications are there in the patient, then she can go for vaginal delivery, but advice of the doctor is very important, and accordingly you can counsel the mother-in-law also regarding the need for cesarean section. Thank you.
Thank you, ma'am. I think you'll be able to hear
Anusi,
me now.
I'm not able to hear
Can you hear?
but yeah,
Hello?
little bit.
Yes, you can hear me?
Can just
Okay.
display the question. I can
Yes,
read
I
it.
think your phone is a little far away, so you're not able to hear me. I'll display the question
Okay.
here, ma'am.
Okay, go ahead.
So, is C-section conducted 2-3 weeks earlier than due date? My doctor has told me this. My due date is 14th Feb. When would I be delivering through C-section?
Okay. So now, as I have earlier also in my talk, I have told that the pregnancy is of 40 weeks. So on your expected date of delivery, it will be 40 weeks, but from 37 weeks to 40 weeks, we consider that the patient is a term patient. So once she has completed 37 weeks, then we consider that the term gestation has reached. Okay, so if there are certain complications like a high blood pressure or a previous cesarean section and a thin scar, then in that case, we usually consider that 37 weeks is the first cutoff. That means 3 weeks prior to your date, you consider as a first cutoff. So, in those cases where there is a risk to the baby, then we will usually say, okay, let us plan a cesarean section at 37 weeks so that there is no risk to the baby. Okay, but beyond 37 weeks, if the pelvis is not good, in that case, we may take the gestation 1 or 2 weeks forward with a good monitoring of the fetus and the mother, and then we can decide. So if your doctor has said that okay, now 37 weeks has completed, it is safe for you to go for cesarean section, then that may be because of certain complications which are existing in you, and that's why she has planned 3 weeks prior to your date of delivery. So it is good enough. Yeah. Next question.
Thank you, ma'am. I'll just share some questions from our users on the app. Hello, ma'am. I have undergone cervix circlage. So, when will my stitch be removed? As I am instructed for bed rest, so I don't have any options for normal delivery because I should not do exercise or walking.
So, in case of an encerclage, that means a stitch is given on the cervix, then usually it is done because the cervix is, not able to hold the baby and there is a chance of preterm delivery. प्रीतम बच्चा होने के चांस होते हैं, इसलिए हम एंसरक्लाज करते हैं. ऐसे में हम रेस्ट बताते हैं, पूरी तरह से बेड पे सोने के लिए नहीं कहते, पर यूजुअली हम चाहते हैं कि जो पेशेंट है थोड़ा रेस्ट ले, and she should not exercise too much, and she should not do any work which can create a pressure on the cervix. So not exactly bed rest, but we are considering that she should not do heavy work. And this type of stitch is actually removed once a 37 weeks of gestation is reached. जैसे कि मैंने पहले भी बताया था, 37 हफ्ते 37 weeks जब हो जाते हैं, तो at that time we consider that the gestation is term. Then at that period of time, the stitch is removed, and we will test the patient. You will do some examination on the patient, and accordingly you will decide whether she can go for vaginal delivery or she needs a cesarean section. इसका डिसीजन हम इस तरह से लेते हैं कि पेशेंट में कोई एग्जिस्टिंग कॉम्प्लिकेशन है क्या, how is her pelvis, how is the bony pelvis, how is the fetus, and accordingly we can take a decision for cesarean section. It is not like this that all patient with encerclage undergoes cesarean section. If the pelvis is good, if the baby is okay, if the mother's health is okay, then she can go for vaginal delivery also. But that decision again the doctor will take after examining the patient. Thank you. Next question, please.
Yes, ma'am. Rashmi has a question. I am 20 weeks pregnant and my bump is very downwards. I got bump in the pelvic area. Is that normal or does it mean that I have some complication?
Okay, so I think she is talking about the baby bump, which she is considering it is low down. Okay. Now, if you are 20 weeks pregnant, that is 5 months, your baby should come up to the umbilicus. Okay, so the baby should come up to the umbilicus only. That means it is usually lower down only. So near the umbilicus and below that only you will see the bump. After the 5 months of gestation, the bump will start rising higher in the abdomen. Now there are two things. Are you feeling that the baby is coming very down? You're feeling a lot of pressure lower down towards your vagina, then it is a problem. Otherwise, 5 months baby is, the bump is only up to the umbilicus and not higher than that. Don't worry.
Thank you, ma'am. We have a question here. Hi, ma'am. My question is the first delivery was C section. Now I am pregnant for second baby. Is it possible to have normal delivery?
Okay, so now that's an important question. So if she has a previous cesarean section, can she go for a vaginal delivery now? It all depends on what was your indication for cesarean section in the prior pregnancy. If it is a recurrent indication, that means if the pelvis is not good, the bony pelvis is not good, height is very less of the patient, the bony pelvis is not good, there are certain complications with the way the bony pelvis is, then maybe the possibility is that you may have a repeat cesarean section. Again, what is the size of the baby? If the size of baby is more than 3.5 kilograms, the scar is not good, it is a thin scar, then there is a possibility that she can have a repeat cesarean section. If previous was a breach and now also it's a breach, or there is any coexisting complication like a transverse lie or high blood pressure or diabetes mellitus existing, or the baby is not growing well, or a fetal distress is there, then there is a chances of cesarean section. However, everything is normal, then the doctor will again examine, find out how the baby is, how the mother is. She will do the fetal assessment. If the fetus is normal and average size baby, then she may go for vaginal delivery. However, this vaginal delivery has to be under strict surveillance and good monitoring and all trained obstetrician, then she can go for vaginal delivery. So it depends, dear.
Thank you so much, ma'am. Shraddha has a question here. She's 34 years old and this is her first pregnancy. Can this be a reason for C-section?
Okay, so 34-year-old, is this a reason for cesarean section? Now, that sole indication may not be the reason, okay? But if the mother is 30 and above or little advanced maternal age, then there are possibilities that in this patient there are certain, other existing disorders like high blood pressure or gestational diabetes mellitus, or the baby may not grow well. So if there is other existing complications, then a cesarean section is indicated. Age alone is not the factor. Associated conditions may be the factor. Thank you.
Thanks a lot, ma'am. There is one more question related to previous CSEC. She had planned CSEC last time and this time also. So she wants to know if there's any chances of vaginal delivery since she has diabetes and
Okay.
hypertension.
So you have three complications. One is previous cesarean section. Another, you have diabetes. Third, you have blood pressure also is high. So, your risk assessment, if you do your risk assessment is higher if you go for a vaginal delivery. So mostly what the doctor will do, she will weigh the advantages over the disadvantages. In your case, a cesarean section has a more chances of safe delivery for you and your baby. So in your case, the cesarean section is a better option.
Thanks a lot, ma'am. Priya has a question here. I am 38 weeks pregnant with a baby in breech position. Doctor has advised CSEC and planned it either on 25th or 27th of Jan when she completes 39 weeks. Now, will it be a problem if she gets labor before that?
Okay, now sometimes it happens that the patient goes in labor before the planned cesarean section. So maybe tomorrow's cesarean section plan and she goes in labor now today itself. So what to do in these cases? There is a chance that the patient may go in labor before the planned cesarean section. So she should be aware of what are the signs and symptoms of normal labor, like she may have pain, she may have watery discharge, and she may have slight amount of bleeding. So in that case, she should be always ready to go and inform the doctor about her pain. She should also have somebody always there with her in the home so that she can be taken to the hospital in time. So there is a possibility, not always, but sometimes there is. So she should be ready So that is called as birth preparedness. So your vehicle should be ready. Some person should be ready with you to take to the hospital. Most of the time, that she may not go in labor, but if she goes in labor, she should be ready with of the eventuality, and she should be, she should also have what we say, the baby's movement. She should be always be alert about that. And anytime she feels that baby's movements are less or she is going to labor, she should report to the doctor and not wait only for that day wherein her cesarean section has been planned. So be aware of the warning signs and report to the doctor.
Thank you so much, ma'am. We'll just take a couple of questions more. I know you have another session, so just two questions, I think. Um, Sugandha is saying she is in the 20th week of pregnancy and her anomaly scan says that the placenta is placed anteriorly, grade 1 and not low lying. Is it too early to predict the delivery procedure? Will it be normal or C section?
It's quite early, dear. So what happens, 28 weeks is very early. We usually take the decision for a cesarean section or a vaginal delivery nearing term. So after she reaches, term, because we will try to judge what are the existing conditions, the blood pressure, the sugar, what is the lie of the patient? Is it a cephalic, that means by head? Is it by breech? What is the amount of liquor? How the placenta is? So any other complication that will decide about the mode of delivery. And even if we go for vaginal delivery, we have to watch the progress of labor, how the baby's heart is. The heart is good, the fetal heart is good, the progress is good, then we can go for vaginal delivery. But always it is decided nearer term. As she goes nearer her expected date of delivery, then we can go for a decision. Prior to that, if there are certain complications existing, then we may plan a cesarean section or she can go for vaginal delivery. So this is too early.
Thank you, ma'am. Last question today. Vaishali has sickle cell anemia and 32 weeks pregnant. Is there danger during C-sec because of this? And she also wants to know, is there an ideal weight that the baby should have for C-section? Like, is it likely that a more healthy baby will create complications during C-section?
Okay, so now first of all, the first question, she is having sickle cell. Now, again, in sickle cell, there are two types of sickle cell. One is called as the sickle cell trait, and another is called as the sickle cell disease. Okay, so in sickle cell trait, the pattern of the hemoglobin is AS pattern or SA pattern. So S is the sickle hemoglobin and A is the normal hemoglobin. So she may have one normal and one abnormal. So SA. And in sickle cell disease, she will have SS. So that is a little, advanced or major kind of sickle cell. So now in both the cases, you have to initially judge what is the existing condition of the mother. What is the hemoglobin at the time of delivery? Is there any other complication like sickle cell crisis? So if not, if the baby, the mother's hemoglobin is nearing 10 or 11 gram and she doesn't have any complication, then the risk is slightly higher as compared to a normal patient. However, the doctor will arrange some blood transfusion for her and a good assistant, good anesthetist, and she can safely do a cesarean section. So you have to be aware that your hemoglobin status has to be optimal before going for a cesarean section, and your doctor will decide. So if it is a low hemoglobin, she may go arrange for a blood transfusion and then only go for a cesarean section. There should not be any existing sickle cell crisis in the patient, and she may go for a. Now, if she is only a sickle cell trait, that is a SA pattern, then it is not much of a risk, and you can again decide depending on the hemoglobin. What is the second question? Second question I am
She
just
wanted
forgetting
to
now.
know she wanted to know the ideal weight that the baby
Yeah.
should have.
Now, if you talk of ideal weight, usually weight below 2.5 5 kg is considered as low birth weight. Okay, so we usually, for Indian population, you will aim something above 2.5 kg only. But if good nutrition is there, a well-educated lady following all precautions is there, then of course 3.5 kg is considered as a good weight. Now, above 3.5 kg is considered as a macrosomic baby by Indian standards. By American standards, more than 4 kg is considered as a macrosomic baby, मतलब large, बड़ा बच्चा, जिसमें because of diabetes, gestational diabetes, the baby becomes very large. Okay, in that case, we call as a macrosomic baby, and that baby is considered to be a high risk for the baby as well as the mother in case of a vaginal delivery. But if it's a cesarean section, then of course, to remove a large baby may be difficult, okay? But more problem is in the neonatal period. जब बच्चा पैदा हो जाता है तो बहुत ज्यादा हेल्दी जब होता है, 4 किलो से भी जब ऊपर होता है, there is more chances that there may be existing diabetes, gestational diabetes in the mother. That is considered as a risk. Below that, we can, if there is no existing gestational diabetes, you may consider as safe for the mother as well as the baby. So existing conditions also you have to see. A good nutrition, a good educated mother following good precautions usually have a 3.5, 3.7, 3.8 kg baby.
Thank you, ma'am. One last question is there. When should they wear abdominal belt after C-section? When would you suggest that?
After C-section, right?
Yes, correct.
What we usually do is we will give some time for the, the abdominal incision to heal. Okay, so immediately we will not ask the mother to wear the abdominal belt. Maybe after the incision has initial healing has occurred and the stitches have been removed, at that time we will ask the patient to wear the abdominal belt. Before that, some soft cloth will be wrapped around the abdomen of the mother to give her some support when she's walking around or she's going for her washroom and all. But usually the belt which is available at the market, we will ask the patient to wear only after 5 to 6 days.
Thank you so much, ma'am. To all the users watching us, I tried to cover almost all the questions that were related to C-section. I'm so sorry, with the shortage of time, I would have missed a few. But you can post it on the iMumz app in the feed section, and we will get it answered in the next 24 hours. And to ma'am, thank you very, very much. This was really insightful, and we got to learn a lot with you. And if you have joined late, you might want to watch the session from the beginning. Ma'am has spoken about it in detail. So almost all your questions would be answered from there. Thank you so much, ma'am. And we would love to have you with us again.